Hi everyone, it's Gregory Zarin from Healthline, and it's October. You know what that means? It's Breast Cancer Awareness Month. Did you know that breast cancer is the most common cancer among women? 1 in 8 women will die from this deadly disease. However, our mission for the next half hour is to bring you all you need to know to be preventative in regards to cancer awareness. You are the captain of your ship. You are the best doctor you will have. Don't go away, we're going to share with you everything you need to know about breast cancer awareness. The conversation today is all about awareness and breast cancer. Did you know that out of every 100 new diagnoses, up to 1 in 2 are men? Joining me right now is Medical Director of Breast Imaging, Dr. Lynn Chen. How are you, Doctor?
I'm well, thank you. Thank you very much for having me.
We've been to this party before.
Yes.
And I love talking to you because you always give so much information. Doctor, what got you involved in this field?
Well, I've been a breast imager at Glendale Adventist now since 2002, so I've been here for quite a number of years, and I grew up in this area. My family, we have somewhat of a breast cancer risk. I have family members that have breast cancer, and so when I was in training, it was something that I wanted to learn about, and when I did, I wanted to do something about it.
So it was also personal?
Oh, absolutely. Absolutely.
Just straight to the point, Doctor. What is breast cancer?
Essentially, a cancer is an abnormal cell in the body that continues to grow and grow and grow uncontrollably. And if it is not stopped, the cells will multiply, it grows and spreads to other parts of the body, and it stops the normal functioning of the body.
So isn't cancer just a cell in your own body turning against yourself?
Exactly.
Okay.
Exactly.
So you have an angry cell that decides to try to take you down.
Yes.
What types of breast cancer are there? How many types are there?
Well, the 2 most common types of invasive breast cancer that we talk about are ductal carcinoma, which is the more common type, and then there's the lobular carcinoma, which is less common. The non-invasive are what we call ductal carcinoma in situ. That particular kind of cancer in situ means that it hasn't invaded the basement membrane of the breast. So essentially, it's contained in that area.
Doctor, when we talk about cancer, we hear of 2 types, benign and malignant. What are the differences between both of those? Well,
tumors can be benign or malignant. Benign tumors are not considered cancers, so they don't grow uncontrollably. The malignant cancers are the ones that we are concerned with, and those are the ones that require treatment with surgery and radiation.
So, Doctor, backing up a little bit, when something is found that's benign, what does that mean then?
A benign lesion, such as a cyst, which is a fluid collection. Another common benign lesion is a fibroadenoma, very common in women. Those lesions are not cancerous. We don't have to treat them. In general, cysts generally they go away on their own. And fibroadenomas, they may grow to a certain extent, but they stop growing. So those are considered benign and don't need to be treated.
So if you actually do go in and you get checked, you're hoping for something that's benign?
Yes, either nothing at all or something that's benign.
So I'm rooting for nothing at all. When we come back, more with Dr. Chen, and we're going to share with you how to do your own personal self-exam. More when we come back. Don't go away.
I'm Dr. Lynn Chen. I am a radiologist at Glendale Adventist Medical Center. I am a medical director at the Breast Center at Glendale Adventist Medical Center. I grew up in Pasadena. I went away to college and medical school at Harvard. And after Harvard, I did my residency and fellowship at UCSF in San Francisco. And after that, I've come back and worked at Glendale Adventist ever since. For as long as I can remember, I've always wanted to be a physician. When I was in medical school, my mom had a scare. She developed a breast lump. It was benign. It did not turn out to be a cancer. But we were all very afraid, and that was the background, the incentive of why I decided to go into breast imaging and become a radiologist. I'm proud to say that our department has all digital mammography and top-of-the-line breast ultrasound and breast MRI. We are hoping to bring new technology to the campus with tomosynthesis and MR spectroscopy of the breast. My ultimate goal for my patients is to detect the smallest possible cancer if they have one, to help them through with the diagnosis, the surgery, and the treatment, and hopefully help them find a cure.
Welcome back. Did you know that the U.S. Preventative Service Task Force recommends that women get a mammogram every other year at the age of 50 and over? How do you feel about that? Joining me is Medical Director of Breast Imaging, Dr. Lynn Chen. Dr. Chen, what? You know, a look is 1,000 words. What do you feel about that?
Well, as you know, for many, many years, the recommendation among all of the medical societies is women should get a screening mammogram at the age of 40 every year. And several years ago, the U.S. Preventive Service Task Force changed the guidelines. But in reality, most of the medical societies still follow the old guidelines.
40.
Starting at 40 and every year.
However, if it's hereditary in your family, when do you suggest that somebody starts getting mammograms?
If there is a strong family history of breast cancer, then I would recommend starting screening 10 years earlier than the age at which your first degree relative developed breast cancer. So for example, if your mother developed breast cancer at age 45, then you should start screening at age 35,
Okay.
10 years before.
What if somebody is 23 years old and she just wants to come in with no history of breast cancer in her family and wants to come in and get a mammogram? Is she sent away?
In general, she needs to go talk to her doctor.
Okay.
And figure out a reason why she wants to get a mammogram. Does she feel a lump? Does she feel pain in her breast? In which case we would want to evaluate with an ultrasound and a mammogram. We generally don't recommend routine screening in such a young age because first of all, the breast tissue is very dense,
Okay.
and the utility of mammography is limited at that age. And also the inherent risk of breast cancer at such an early age without a family history is also very, very small.
And speaking of a mammogram, doctor, here you have imaging from a mammogram.
Yes.
What are we looking at?
So for a screening mammogram, that is for a woman who doesn't have any symptoms, we image both breasts. We take two views of each breast.
Okay.
So in this view, it's called the craniocaudal view. This is the right breast and that's the left breast. And craniocaudal means that we compress the breast up and down like this. And that view is called the MLO, or medial lateral oblique view. And there we compress the breast side to side. And essentially it gives us two images of the breast so we can localize abnormalities, we can see things better.
So you can look through and see everything.
Yes, as you can see, this is the nipple here. We mark it with it's called a metal BB. And so that's a nipple and that's a nipple. And then on the MLO view, this part is actually part of the chest wall here.
Okay.
So we actually do image the breast.
Welcome back. Thank you for staying with us. The conversation is all about breast cancer and self-exams and awareness. And before the break, Dr. Lynn Chen, Medical Director of Breast Imaging, shared with me that most people in the industry do not support fully the U.S. Preventative Service Task Force about every other year and the age of 50. They basically rely on earlier, I don't want to say rules, but earlier guidelines. Recommendations.
Guidelines, yes.
And here's the thing. Your body is yours. So why not do what you can to find out if something is up? Breast exams and self-detection are really important, and it's also
Yes.
for men.
Yes.
So just say somebody wakes up and they want to do a self-exam. Doctor, what are we in fact looking at doing the right way?
Okay. First of all, I recommend that women look at themselves in the mirror
Okay.
to see if there's a change in the contour of the breast, to see if there's dimpling, See if the nipple all of a sudden has become inverted.
Okay.
So visualization is important.
So that's not common, inversion of the nipple, dimpling,
No, if there is a
size
change.
change.
Exactly. If there is a change, that's the key. You are
Okay.
looking for a change.
Okay. Ladies, do you hear that? If there's anything that looks remotely different and you are standing in front of a mirror looking at yourself, that's a cause for pause, and that's when you call your doctor and say, hey, you know what, there's something a little bit off. And same thing with men as well, yes?
Absolutely, absolutely.
Okay, so far, just say everything is okay. Then what else do you look for, doctor?
Well, then I'd recommend the breast exam,
Okay.
which should be performed once a month.
Okay.
And there, what you want to do is you want to examine the entire breast gently to detect superficial lumps.
Okay, so
And
if I'm
then-
doing it now, my arm is raised,
Your arm is raised.
and I'm right
exactly.
here overlooking my pec, my big pec.
So then at first you want to examine gently to
Okay.
detect any superficial lumps. And then you want to press more firmly to feel for deeper lumps.
Okay. And how far over to the side do I go?
You want to go as far as you can because the
Okay.
breast tissue can actually extend all the way back here, all the way to the armpit and up here.
Okay, so check everything. If anything, so here's a question, and you do it on both sides. So just say you check and you feel a little bit of an abnormality, and do you immediately call your doctor, or do you, in a month later, go, hey, you know what, I want to check and see what this is? Do you just pay attention to it? Because it could just be maybe swelling, it could be a bruise, it could be calcium, it could be anything, right?
Well, if you are doing regular breast exam, and this definitely feels like a change for you,
Okay.
then I would recommend that you go ahead and call your doctor and have your doctor examine your breast, because if it's just a cyst or something that is related to just hormonal fluctuation, by the time you see your doctor, most likely that might have gone away. But if it's something more serious, you don't want to wait too long.
And there's no age. Anybody can check themselves. And you
Exactly.
truly recommend.
Exactly.
So no matter what, take off your clothes and look at your body and find out what's going on, what's not going on, because you are the captain of your own ship. Now, Dr. Chen, before we lose you, some of our faithful Healthline fans have sent us some questions. Can you get breast cancer from wearing the wrong bra?
Absolutely not.
Okay.
There has been no scientific evidence to show that you can get breast cancer from wearing a bra.
You can get breast cancer from smoking?
Yes, from smoking. Alcohol is a well-known risk factor
Okay.
for breast cancer. Being overweight is another one. In general, anything that can increase the production of estrogen in the body
Okay.
can predispose to breast cancer. So hormone replacement therapy after menopause can do that as well.
Dr. Chen, what are some of your personal solutions to anyone so they can prevent breast cancer?
I think the easy lifestyle changes are being more physically active.
Okay.
No alcohol or minimize your alcohol intake. Stop smoking. And then the most important thing is to get a screening mammogram every year after the age of 40. Because we all know that you can do everything right and still get breast cancer. And the key to treating and curing breast cancer is to find it at the earliest stage possible. So screening mammogram, hands down, is the best way to deal with breast cancer.
Can somebody get breast cancer from getting too many mammograms?
There's always talk about the harm of radiation.
Too much.
Too much radiation. But the benefit from detecting breast cancer from routine screening mammogram, even from starting at age 40 all the way up to 100, far outweighs the risk of radiation.
Dr. Chen, thank you so much. More on preventative measures and the conversation of breast cancer when we come back. Do not go away. So when you hear of getting a mammogram, for those of you that have never had one, you wonder, oh my gosh, what happens? However, this is where the magic is made. Joining me is Danica, mammographer here at Glendale Adventist Medical Center. How are you, gorgeous?
I'm good. How are you?
I'm fantastic. So this is where I want to say the magic is made. When someone comes in to get a mammogram, what are some of the signs and symptoms that they're looking at that maybe there's a cause for pause with?
Breast pain.
Breast pain? On a scale of 1 to 10. Is there normal pain in a breast?
We usually don't put it on a scale of 1 to 10,
Okay.
but patients sometimes describe it as sharp pain
Okay.
or just pain throughout the breast.
Okay.
So depending on what their concern is.
So looking for that, what else?
That also changes in breast tissue
Okay.
and itching,
Okay.
nipple discharge, or feeling an actual mass in their breast.
So those are symptoms that
Those are
someone's
symptoms.
that you're looking at.
Right.
However, somebody just needs to come in every year and get their breast checked.
Right, because there are things that show up on the mammogram that they don't feel.
Okay, so speaking of that, so just say a young woman gets her mammogram and the results come back and you want to recall the results.
Okay.
And just say that there is something that shows up and it's not a tumor, it's not something that is cancerous. What are other things it can be? Because I know a lot of friends of mine have gotten a test and they said, oh my gosh, my doctor called me and said I have to go back
Right.
and I'm petrified. And it
Yeah.
ends up being nothing. What is that great nothing?
Sometimes there's cyst.
Okay,
Sometimes there is a superimposition of breast tissue, so depending on the positioning,
Okay.
sometimes breast tissue is sort of overlaying
Okay.
other breast tissue, and so it shows up as something. And usually when you take a smaller view and you spread that tissue out, there's nothing.
so in regards to the panic of, oh my gosh, they found something, what do you recommend to the patient that is in that window of waiting of, it could be something, maybe, hopefully it's nothing?
That most times it turns out to be nothing,
Okay.
and that they shouldn't worry until the additional testing is done and they're cleared, because most times there's nothing there.
Since you do this all the time, and there are people out there that don't come in for mammograms, what do you say to them?
There are so many things that can happen inside your breast that you don't notice, and
That can happen quickly.
that can happen quickly in a short period of time, sometimes even between mammograms. The reason that people should come in is that there are so many things that we find that a patient doesn't feel, and there's so many options now that that can be resolved where they don't have to have major surgeries and things that they used to have in the past. So the earlier we catch something, the better it is, because then we can do smaller things to resolve it as opposed to something major.
Danica, when someone comes in for their mammogram, anything you think they should need to know, not know, do, dress?
They should try to wear two-piece clothing,
Okay.
because the gowns are made specifically for the top. No deodorant or lotions,
Okay.
because some components of those can show up on the mammogram as a concern. And tie up their hair if they can, because hair also shows up on digital mammography now.
Do girls and women need to be afraid for their mammogram?
No, it's a quick exam. It may be a little uncomfortable, but
So it's not,
doesn't
so it
last
doesn't
long.
hurt? Because a
It
lot of my
doesn't
friends go, oh, it hurts.
No, it's uncomfortable. I'll say that. But the better the compression, the less radiation you receive, and the better the tissue is spread out.
So you heard it from Danica, the better the compression, the more efficient the mammogram. What are you waiting for, ladies? If you have any questions or concerns, call 818-409-8000. Be connected to Breast Cancer Services, and they will answer all your questions. So Dr. Chen, in your office, we looked at the mammogram on the screen. Just say there's a cause for pause and you want to do a biopsy. This is where this happens, yes?
Yes. So let's say on this mammogram we found some abnormal calcifications, which may represent ductal carcinoma in situ, an early form of breast cancer.
Okay.
And this would be where we would do the needle biopsy. It's called a stereotactic biopsy. The patient would lie on her stomach and the breast would hang through this aperture in the table. We take pictures of the breast to localize the calcifications, and then there's actually a computer that targets the calcifications
Okay.
and allows us to place the needle very accurately within millimeters. And we, once we determine where the calcifications are, we anesthetize the breast, we put in the needle, take out a little bit of tissue, and send it off to the lab.
So perfect case scenario, there's nothing wrong.
Yes.
Worst case scenario, you find cancer. What are some of the treatments then that happen from there?
Most patients who have very small cancers can undergo what we call breast conserving therapy, essentially a partial lumpectomy or partial mastectomy, where that part of the breast is
Is removed.
surgically excised. And then she will also require radiation therapy afterwards to essentially ensure all of the cancerous cells are eradicated. Now,
Chemotherapy too, or is that
possibly
okay.
chemotherapy. Possibly it depends on how big the tumor is, what kind of a tumor it was. Now, there are certain women who have larger tumors, for example, who have a genetic mutation that predisposes to breast cancer. Many women then would opt to go and have a complete mastectomy where the entire breast is removed.
And Angelina Jolie internationally
Yes.
so famously had both breasts removed because her mother passed away from that as well. Do
Right.
you recommend that course of action, or is each case personal?
I think it's a personal decision. There are many women who feel strongly that they want to preserve their breasts, and there are ways to do surveillance to determine whether there are small tumors that are developing, and breast MRI is a good way to do that. But for many women who have the G mutation, they don't want to live with that constant fear. And so for them, perhaps the double mastectomy is the way to go.
And once everything is cleared after the double mastectomy, then there's reconstructive surgery.
Exactly. And that really decreases the risk dramatically.
And bottom line is early detection
Early detection.
gives you so many more options.
Absolutely.
Thank you so much, Doctor.
Thank you.
As Dr. Chen just said, pay attention to you and your body and realize the earlier detection, the more prevention. More when we come back. We just learned early detection is linked to prevention in regards to breast cancer. You know what you got to do. If anything seems different, call your doctor. Self-examination is key. For more information, call 818-409-8000. Be connected to Cancer Services, because remember, the most important conversation you're going to have is the one about you and your health. So why not start one today? We'll see you next time on Healthline.